meeting to order the Board of Health, please. Thank you. We're going to call this meeting of the Board of Health to order, please. First item is review of the previous minutes. Do we have a motion to accept them or any changes to be made?
Motion to accept. Second.
All in favor? Perfect. Thank you. Next on the item is Caesar to give us our update from the Tobacco Monthly Report. Caesar?
So tonight we have a tobacco permit suspension hearing for 7-Eleven located at 970 Worm Street. We did a round of compliance checks on January 12th. We checked 38 establishments, and 7-Eleven was the only one that actually sold tobacco to a minor. This pack of Marlboro cigarettes was sold to that 19-year-old boy that you see a photograph before you on the table. Pretty straightforward. I mean, the history with this store is actually excellent. We haven't had a lot of violations with them. The only one that I could find was like an educational, there was an inspection and there was an educational opportunity for something that was not precisely correct, but there was no sale to a minor. This happened a while back. But more recently, we did a compliance check and they failed. Let me just double check one more thing here. The person who made the sale did not ask this kid for ID, for age, nothing. He was not challenged at all, and he's only 19. Yeah, the only violation that I see here happened April 11, 2021. It was like either a signage violation or something else that was going on that day. Perhaps the letters. I don't have that record here right now. Country Farms? You just have a seat somewhere there. This is pretty straightforward. There was nothing unusual about this sale other than the fact that a sale occurred. Minor was not challenged. He was sold a pack of cigarettes. Consistent with state regulation, local regulation, my advice or recommendation would be to carry on the suspension for 3 consecutive business days. But Mr. Nellam Marquardt, the manager and owner of this franchise, is here to address the board. If we just go to the pulpit.
Alan Marquardt, store's address is 970 Gorham Street, Lowell, Massachusetts.
Do you have something you wish to tell the board?
No, not challenging it. The individual that sold to the minor has been let go. Just let that person go. I've been in the establishment for 11 plus years, like Caesar said. Him and I have a great working relationship. You know, even when the Newport Greens came out, I contacted him before even wanting to even try to sell them. You know, I own another 7-Eleven in Drake. Been there for 26 years. Never had a violation over there. So, you know, I'm not challenging it. Willing to take my punishment. I paid the fine immediately. You know, my employee did wrong. I'm not trying to challenge anything. So
Great.
I just, you know, all my employees have been reiterated with what the laws are, that you need to ID everybody until you know that person's of age and you sold multiple times to them, that they need to ID everybody. So
Okay.
we have a beer and wine license too, and they know to challenge them. That girl that day was a little too busy talking with other people and not paying attention to her job. So I do apologize.
No problem. Does anybody on the board have any questions? No? Thank you, sir.
Thank you.
Caesar?
My recommendation is a 3-day suspension to begin on April 22nd. It's a Monday. I'd start a business.
Okay. We want to make that motion?
Motion for the 3 days, starting on that day.
All in favor? Aye. Yes.
Yes. Yes.
Okay. Thank you. Thank you, sir. Appreciate it.
Ellen, you'll receive a certified letter explaining how that suspension is going to go. If you have any questions, you can just talk on the phone. But basically, you've got to remove all tobacco products from the premises before the start of that suspension time.
The date was
The 22nd, April 22nd.
Okay. Thank you very much.
Thank you for coming.
Thanks.
Next, we have Country Farms, located at 268 Branch Street. This is an intervention. This is something different that we're doing tonight because they're not here for tobacco permit suspension hearing. They're here because they've had multiple violations recently. And this is a chance for us to have a chat with the management of this establishment to find out why this is going on and hopefully prevent from getting further violations and further penalties. The next penalty for this store will be a $5,000 fine plus a 30-day tobacco permit suspension. So let me just go over the history a little bit. Before you have a letter from DOR suspending their their cigarette license for 30 consecutive business days that began on March 7th. This was because they had unstamped cigarettes there. But that was not the only violation that occurred on that particular date, because unstamped cigarettes. In addition to the unstamped cigarettes, they had unstamped vaping products and unstamped
Maybe just explain to the board what unstamped means.
without the Massachusetts stamp. So this could be cigarettes from a different state. They did not have the Massachusetts stamp. That's required for every retailer before they can sell the tobacco product. So they received a warning letter for not having stamped vaping products, a warning letter for not having stamped cigars, and they were suspended for 30 consecutive business days for not having stamped cigarettes. As you probably know, they had a violation on May 16th of 2023. They sold tobacco to a minor. They got issued a fine of $2,000 and a 7-day suspension. And in the same year, on January 12th of 2023, they had a first violation under the state law on the 36-month period, and they got a fine of $1,000 and a suspension for 3 days. But even before then, they had a warning letter issued by the FDA. Usually the FDA issues warning letters when an establishment fails an inspection or a compliance check. So oftentimes it's a compliance check, so usually it's a sell to a minor. So there was one on April 4th of 2019, and they also received a warning letter from the FDA on June 18th of 2015. And during a recent inspection, on February 28th of this year, the inspector was there. There were a cigar packaging and pricing violation. Remember, we changed the regulation last year to say that the mere presence of these products would be a violation. Instead of issuing them a citation, we took the moment to educate them, remind them, reiterate what the law expects them to do. And then in a conversation with the clerk, Jonathan, my contractor, who does some of the inspections in Lowell, he heard the clerk, because he was visiting the store because of previous violations and talking about the importance of actually asking people for ID. So the clerk said, well, if the person looks suspicious, ask for ID. So this happened on February 28th. Mr. Patel was a person with whom he's had a conversation. And other than that, on May 15th of 2021, they had letters and signage violations. Again, it was just an educational warning. We did not issue them a citation. Again, on April the 21st of 2021, signage violation, having vaping products exceeding 35 milligrams of nicotine, and cigar pricing packaging violation. So as you can see, cigar pricing packaging violations have occurred a couple times already at that location. We still haven't issued them a fine for that. Just trying to help them understand. Sometimes we think there might be a language barrier. I don't know. But that's the reason why we brought him here before you tonight, because next time there's a violation, there's going to be a citation that's $5,000 plus a 30-day tobacco permit suspension that's going to be on the line for them. And this is a chance for the management to address the board to ask any questions it may feel like.
I have
Tonight,
a question for you, Caesar, before you do it. So some of these warnings you gave, at what point do you say no more warnings? Are you telling, is that what you want us to tell them tonight? There's no more warnings for any of these other violations as well?
I think I've exhausted all of the opportunities to educate them about the regulations. The stuff is being recurring. It's not like new stuff. So this is.
But the law only is specifically about selling to minors. That's prescriptive. The rest of it is subjective, up to you and us to decide what to do.
We treat a sale to a minor just like the state law does,
Yeah.
as a more serious offense.
Yeah.
So if there's a sale to a minor doing a compliance check, we issue a citation and they come before the board. Other violations is pretty much we have some latitude as far as what we determine to be whether this is like a deliberate thing or whether it was a mistake. where there was a misunderstanding. We take every opportunity we have to educate them as much as possible before we issue them a citation. But since we changed the regulation, this shows you that we're not out to just say, we passed the regulation, now if you have these products, we're going to fine you. They've been educated several times, and they're still showing up with these products. So this will be the end for me. If there's a next violation, they'll be fined $5,000, and they'll be out for 30-day suspension. So we have Mishank?
Yes.
Mishank Patel here tonight is going to address the board on these issues.
Mr. Patel, you want to come up here, please? Or come up to this podium? Can you
Hi,
just state your name and your address, please?
Hi, my name is Mishank Patel. Do you want the store address or I help my friend managing store at 268 Brand Street, Lowell, Mass. Mishank. Yes, I agree with Mr. Caesar that we had previous violations, but I don't know anything before 2019 or 2020. But the first violation we had for the selling to the minor, we changed an employee. We got a new employee, trained them well, and the new employee got in another violation too. So we changed another employee, and we implemented a system where they have to check ID for every customers, and we have a scanner now which scans actual IDs. I mean, I'm not trying to challenge anything. We did mistake, and we could assure. I mean, it's not gonna happen in future.
How do you explain the unstamped cigarettes?
Well, my friend owns a store in New Hampshire, so he was short on cigarettes. So I brought him from another store so he could pick it up, and some vapes that he was short on. It wasn't for that store. It wasn't for the Country Farms, but I live in Tingsboro. I own another store in Nashua, and he has a gas station in Londonderry. So I just dropped it because we couldn't meet at the time, and it just happened on the right time. It was vapes and cigarettes, but we don't actually sell at the Country Farms due to the loss. And there was another violation that was something about the flavor cigar, but that we did not order. We were going by the SKUs, and I don't know, for some reason it was a glitch in the system to the wholesaler or something. I have an invoice right there for it.
Well, if that was a glitch, but they were on the shelves, though, I assume.
Yeah, but it was that they got delivery on the same date, and the employee put it up not knowing that. Because everything you get from the manufacturers, some things are just blocked. Like if the law prohibits them to sell it in Massachusetts, they don't usually send it out. But it was from the wholesaler. I could show you the invoice, and you can probably match the date too.
It doesn't really matter.
No, I understand.
Okay.
We did mistake.
Right.
And as we said, we tried swapping employees multiple times because of the issue. And I mean, I don't know how to explain about the cigar thing that actually manufacturers send, which is banned in Massachusetts. Or the wholesaler, I meant.
Do any board members have questions?
Well, if you have something that arrives into your shop that's not allowed in Massachusetts, even if it's an error, it's a managerial, responsibility to
Yes, but
screen
I
that.
wasn't there at the time, and it was about that couple hours thing, and the inspection went in. So
Well, just from
employees
now
just
on,
put
I
it on the
suppose, when you
shelf.
get your shipments, then one of the managers will have to make
yes,
sure.
so
that-
now we did tell the wholesaler to send us the invoices too before the things gets delivered, so we can look into it, even though if we are not there. And we check the invoice and call the store and let them know what to put on the shelf or what to not. I mean, usually that doesn't happen, but it was just that day.
But if it were to happen again, it's a big fine for you, so I just want to make
Yes,
sure that you have a
that's why
process.
we are taking
in
every
place.
precaution we could.
Sir, I've been on
Prevent
this
that.
board for maybe, 10 years or 15 years? This is the single most violations when it comes to cigarette selling and cigar selling I've seen in any store ever, by far. So you can have an excuse for every one of these,
No,
but they all add up to poor management
Yes.
and you not taking it seriously enough, your responsibility about selling tobacco seriously enough. Just to be honest with you, lots of excuses. Maybe that randomly that inspection showed up just when the cigars arrived. Just having a hard time believing that every one of these is excusable because
no, I'm not saying it's excusable. It's a mistake. and we're just trying our best to take precautions. And
What I think Dr. Galvin wants you to know is that mistakes happen all the time. Anybody can make a mistake, and you've had recurrent mistakes over and over again. And so the next time, no matter what happens, we'll have to fine you a large amount. We don't want to have to do that. We want to make sure that you're screening these things properly
yes,
so that you don't end up in that situation. And he's wanting you to take it seriously and make sure that you have some process in place to make sure that that doesn't happen.
yes. I mean, we have instructed our employees well now, and we're just carding everybody for the underage part. And the flavor thing, I mean, that was the main mistake, the flavor thing. Other than that, I take responsibility on me that the underage sale were our mistake. And yes, yes. I mean, it's not gonna happen again for the cigarette part and the vape part, and it wasn't particularly for that store. That was just gonna go to store in Londonderry that we own, but I just don't want to take a ride there, so I left it there, and he was gonna go to Country Farms and grab it. But yeah, but we are not gonna do it no more. We'll rather leave it at somebody's house and pick it up.
I'd say, I just want to add that, this is my experience with the store. The store is loosely managed. I don't recall ever talking to a manager there. There's always an employee. And that employee shows varying degrees of not possessing the right knowledge about, like, the most obvious things, like you have to card everyone. The law changed in 2019 to require every person to be carded despite their appearance. And so we have a recent inspection where the clerk says, well, only if the person looks suspicious, I'm going to ask him for ID. I mean, that's a clear indication of perhaps the person not carrying or not receiving the appropriate training. So it's usually one employee there. Managers are never there that I recall, and that's part of the problem. So they may admit to the violations, but what I'd like to hear is how you're going to prevent these violations from occurring in the future. Not just the cigarettes, the unstamped vaping products, but also all the other violations. I mean, this is a ridiculous number of violations for one store. How are you going to prevent that from happening? Because the odds are against you at this time. It's more likely than not that you're going to have another violation, and you don't have to sell to a minor. Just having the wrong product there, it's a violation. And if you have, let's say, for example, cigars in 3-packs or 2-packs, which has been prohibited in the city since 2016, if I recall, then you can get a fine of $5,000. I mean, how are you going to prevent all this?
We do not have any cigars containing less than 4 packs since I'm there. So I'm not sure what year was the violation was
Well,
in.
that's just an example, but he's asking you to let your stores plan to make sure that these details are not overlooked and you end up in a condition where you'll get.
No, we're gonna take complete precaution before we put stuff on the shelf, comply with all the local and state laws, and we're just gonna take it from there.
Okay.
Just so we're on the same page, what is your understanding of the restrictions, the city of Lowell restrictions on the sale of cigars? What do you know? What is your understanding of the restrictions?
So the restriction basically with the laws of city of Lowell is you cannot sell more than less than 4 pack, right? And you have to sell at the certain minimum price. If it's a 4 pack, it has to be over $5 plus tax. If it's single, it's $2.50 plus tax, and anything over that. And of course, no sale of flavor cigars or any type of vape.
That's correct. Can you tell the board how you train employees?
I clearly tell them the prices with the taxes. I show them the online signs and the signs we have in the store. I explain them, and usually all the employees I have, they come from the other stores too, so they're pretty familiar with the laws. It's just basically, I mean, the employees, they price what the system scans. Before, I mean, before 2020, we didn't have the scanner registers. So there was an issue that they used to press grocery button, not taxing or whatever. So there was an issue. That's why we changed the whole system after 2022, just to prevent those things. But we most likely we tell our employees to card every person, regardless of their age or whatever, and to look for the laws and stuff. Like,
What happened to Mr. Patel that actually received a visit from us on February, February 28th? He didn't seem to know that he needed to card everyone. Did you train him?
yes, we did.
Is
That's
he,
why now
is
we
this, is it still there?
I mean, you keep telling them you're not there all the time, and I
Do
mean,
do you spend any time with them when they first are working in the store? Do
Yes.
you work in the store with them?
yes,
Do you have any
Usually-
cameras? Do you watch them through video? Do you have security cameras?
yes.
Do you ever go back and look and see did they actually follow the procedure and policy?
I mean, not all the time. I mean, but
It'd be better if you catch them than Caesar catches them.
yep. So that's why now we have got an ID scanner where they scan ID of each in person. So that's how we know.
Well, that's assuming that your employees actually use the scanner.
We just got it. Like,
I'm just saying that just because it's sitting there on the counter
Mhm.
doesn't mean your employees are you actually using it? They still need to make sure they actually use
yes,
it.
of course. So that's why we got the scanner, so we can match the sale with the ID scanned at the time. So that's how we know how many people he's carding and what the actual tobacco sales are.
Right.
So you can determine like how many people came in and he ID'd and all that.
Yes, but that will be after the fact. I mean, I can say I can say with confidence that there's no system out there that is foolproof. The weakest link is the personnel, the staff. If they're not properly trained, if they're not consistent in following that training, whatever protocols you devise to prevent the sales or prevent the violations, those systems are just useless. Okay, so the training is the key, and the consistency in how they follow the protocols that you have.
Yes, and of course the employee we have right now, he's responsible and everything, and we are gonna have him train for the tobacco training, online certificates too, so he can go through that. I mean,
Okay. You do understand, you've heard this board loud and clear.
yes,
If you have any violations related to tobacco, you'll be coming back before us and you're going to be looking at a $5,000 fine and a 30-day suspension. You understand that, right? Okay.
I mean, not that I want to pay 5,000.
We don't want to see you. We don't want to see you, sir. Anybody else have any other comments? Caesar, are you okay with that? Everything else? Okay, thank you, sir. Appreciate it.
Thank you so much.
Caesar, Caesar, do you have any more? Anything else? No, that's it. Okay, thank you, sir.
This is gonna take as much precautions we could.
We appreciate it.
Thank you.
So the next item is this in-store lung cancer screening. Is there any action to take on this, or is it just informational?
So these were just some flyers that Wellesley College is presenting to try to give out to some of the stores. So they are just trying to give them out to tobacco control officers to put them into the stores.
What's this? What is the? If I scan it, where does it go?
Well, they were trying to put them at the registers.
I asked you. I want to know if I scan it to
Oh.
more information. Where does it direct me? Does it direct you to Newton Wellesley Hospital? Does it direct you to?
Right here, www.
What,
Right.
Do you know what that
It's-
stands for?
It's the American Lung Association, I believe, to tell you what type of screening you need. But what it's going to tell you is it's going to tell you that your doctor needs to order scans for you.
Okay.
So I thought it would be better off in the physician's offices.
That's not going to fly. You can try it. I have no problem
No,
with you trying
I know. No. So, but I don't think the people buying the cigarettes are necessarily going to scan this.
If I may, there's another problem, and I explained to Lisa that as well. I mean, there's absolutely no room in these retail stores. We have to fight to make room for 7 signs that require by law to post. So when you get in there, they're covering the signs with promotions, with lottery tickets, with all kinds of other stuff. So I don't think that's the best venue for these signs. I think it's going to be a waste of paper And they're not going to, I mean, they claim to have good results from, the couple of cities that have tried this to. I just think that, a doctor's office would probably make more sense.
I have no problem with you guys reaching out to doctors' offices. I just don't know what you're going to get from that. But
Libraries, city hall,
Yeah.
things like that, general places.
well, what about the Lowell Sun? Just why do you
A
need?
media campaign.
Let me back up. Why do all? I'm not sure why you need all of these.
Oh, no, I think just one would be fine.
Okay,
Yeah.
all right.
I think
thought-
you could pick one. Yeah, I
Got
think
it.
you could pick one.
I mean,
Yep.
my personal recommendation, if we feel strongly as a Department of Health, that we would put it in the Lowell Sun
Yep,
and let everybody who wants to scan it.
right.
I do know that most primary care doctors in the Lowell area are offering this. Lowell General
Great.
does offer this routinely.
Fabulous.
I have no problem with you reaching out to doctors' offices if you want to. I just don't know what we're going to get from it. But you're welcome to.
Yeah, I think a media campaign at some point, yeah, would be great. And then having the health department offer it when we table at things. Yep. So people could scan or take it home with them. Yep,
Selfishly, I would say when you put in the Sun, the scan should come to here and then direct to Lowell General. But that's just me.
I could do that too.
And biased, of course.
Absolutely.
You need to make your own paper with your, so that that Q thing goes right to the low number.
Night, folks.
Right.
Thank you.
Thank you, Caesar.
Have someone do that.
Okay. All right. Thank you. Anything more on this topic?
No.
Is that okay? Next would be the monthly development service report submitted by Sanitary Code Inspector Jimmy Lee, and we have somebody else in his
We have a
place.
stand-in, Lloyd.
You want to come on up here, sir, first? So as you're coming up, Joanne had two questions, which I'm going to ask first, if that's okay with the board. So in this report, Market Basket, I don't know if you have it with you.
Yes, I do.
So the second one down, Market Basket failed on February 29th by Matt, but that was not listed in the list of places that were cited. Could you just tell us what Market Basket was cited for?
I'm going to have to get back to you on that.
Okay, that's fine. For the next meeting, it'd be great if we just include that in the next meeting's report. Be fine. And then the second question is, there's a little confusion on the actual report about closed entities with the Robinson School. There are two separate entries for the Robinson School with 4 different dates all around each other. So we have 122 and 229, and then we have another that says 117 and 37. Is that just a misplaced, is that not supposed to be the Robinson School for one of them?
I am not sure. I would have to get back to you. Jimmy Lee's not available right now, so
Yep.
I'm going to have to question that.
Okay, so we need clarification on both of those issues.
Right.
That'd be great. Does anybody else on the board have any questions about the report? Yeah, but they're all relatively minor things compared to usual school things. If that's the Robinson, right? We don't even know what. So I agree. I think we need clarity on those for next month.
Yeah, it is.
So I'm not hearing any other burning issues at the moment. Okay. Anything you have to add, sir?
No, I don't, but I did reach out to DPW Commissioner Paul St. Cyr, and I talked to him about these minor issues that were at the schools. And I did talk to Rick Underwood, who manages the schools, and I told him about the rodent problem. And he said he was going to go back out there and clean it and get the Bane out
Yep.
there to manage the rodents.
Okay, great. Thank you. Thank you, sir. Appreciate it.
Okay, thank you.
Thanks for coming today.
Yep, thank you.
He had sent an email. Yeah, yeah. He sent an email and said everything was much better and And the teachers were in compliance.
Sorry, there was a follow-up email specifically about open food in the classrooms, right?
Yep.
Yep. All right, next is the Pride Star report. Does anybody have any comments or questions regarding the report?
They aim to come next month.
Yeah, should be next month, right?
City's gotten a little quieter.
Well, I get excited, then you go back to a year ago and go, April was 106 last year, so we can't get too excited because it bounces, right? So we'll see. All right, thank you on that. Next up, cruising right along here is the funeral director's licenses. We need to approve all the licenses which were included on the sheet for you all to look at. Are there any concerns from the department regarding any of these people? And all of them are, all applications complete, dues paid, et cetera? Great. Can I have a motion to approve them?
Motion to approve.
All in favor?
Aye.
Yes.
Yes. Yes.
Next on the list is nomination for the animal inspector to nominate Gerald Eman as the animal inspector 2024 to 2025. Can I have a motion? Well, actually, is there any discussion about that first? Could I have a motion to approve? Second?
Second.
All in favor?
Aye.
Aye. Yes.
Yes.
Yes. Yes.
Next item is the Pawtucket Memorial EMSL Analytical Mold Report. Always a hot topic here. I didn't see anything jumping out as being crazy abnormal. Did anybody here see anything that we're concerned about? They were all under.
Yes, they're all under. Next month, do you want me just to include the beginning part with the survey if none of the rooms are under, or just the first part that includes the classrooms and not the back part?
I think if Joanne likes to see, I think if you include the.
Yeah, the first part there,
Right, yeah.
but not the green pages?
Correct. Save a couple trees.
Yeah,
Yes.
and then maybe when the windows are open, if things are off, just include the full report?
Yep.
Okay,
Anything that's abnormal, include, the rest don't.
okay, thank you.
Great, thank you. Next is the wastewater viral testing report.
Yeah, I'm sorry, it didn't print out well,
Come on,
but
it's good this month.
nothing has gone up, everything's down, so I think we're looking good.
Perfect, great. This will just continue indefinitely that they do the testing for us now?
I think they're going to continue indefinitely, yeah.
Okay.
Um,
Thank you.
And the same thing, I'll just include it if if things go up, or maybe what I'll do is just give you a summary of what's going on one page versus printing and killing trees.
Yep, sounds awesome.
Okay.
Excellent idea, yes.
Okay.
Yes, thank you. These things only hold so much paper in them, you know? Next on the list is, really, we're at the director's report already. Look at that.
Yes. So I did get on the director's report, I did get a little text from the chairperson. So we did try to tease out what the meaning of the TB cases are, and Nicole tried to write it. So they're changing how they're doing things. So we tried to, it took us a little while, but we did try to figure that out for you. So they are putting in the latent TB and the B waivers in there, and they're also including the contacts for the, oh goodness, the contacts for the latent TB and pending contacts as well. So there's a lot in there.
I gotta be honest,
In the LTBI category.
this is one of the most unclear reports
It's very,
we ever see. And I
Yes.
appreciate the effort to explain the LTBI and some of this, but this is still not written in a way that any human being that doesn't do this on a regular basis can understand it.
Correct. So basically, if you're a contact to a latent TB and you may get TB at any point in your life, you are going to be a suspect for the rest of your life and sit here on this report.
okay.
Okay, that's fun.
So
Okay.
that's the LTBI category is what you're talking about.
LTB suspect category.
Where is that? Is it-
I'm going to make it so confusing that you're never going to be able to figure out, and it's job security for
At the
me.
end of the day, can you just tell us how many people in the city are being treated for TB? How many were actually diagnosed with TB, not revoked? And how, including latent TB if you want, and then if you need to give us the number that you're following, fine, but like literally.
Well, we could try and do that, but,
There's 70
yeah.
actually confirmed cases this month, is what you're saying, and 11 suspects.
correct. So it's the actual that you want. Don't look at the suspect, look at the actual. That's what you want.
Correct.
The actual.
From a health department and a community health perspective, it's the actual number.
It's the actual.
And is it going up or down,
Correct.
or whatever, it's
Right.
not,
You want the actual.
yes.
And you also would like to look at the cases of who were actually going out and we're actually doing, the public health nurses right now are doing direct case management on 12 people. We're doing DOT, drug observed therapy, DOT on 12 active cases right now.
12 out of 70.
No, right here, like, so 12, because those patients we follow for up to 9 months. So those people could have been diagnosed up to 9 months ago, so they're not in, right, so they're not in our this month category, they could have been in the past months.
I see.
Okay, so those would have been our active cases.
So just so I make sure I understand, I'm looking at the 2023 totals, there were 660 confirmed cases of TB,
Where are we?
or latent TB.
2023 total.
Latent.
Latent, 12 with actual active disease and 660 latent.
Yeah, 12 on the top
Right,
and 660 at the bottom.
Right.
And that's
Right,
latent.
yeah. Latent, right, okay.
okay.
You're watching people take medication for the 12 confirmed.
For the 12 on the top, yep, okay,
Does that happen for every case?
yes.
Okay.
Okay,
Is that better?
that's what I want to hear, that's what we need to hear, yeah. yeah.
Confusing.
Like, I don't know why we need to know how many were revoked. Revoked means they didn't have it, right?
Well, because sometimes we follow them for a period of time, or we may be going to their house doing,
I appreciate that you want us to know how much work you're all doing, and that's great. I understand there's work involved from a
Right.
department perspective, but from a community perspective, it's how many
Yes.
have it. If
Yes.
they don't have it, I don't care about it.
well, because sometimes because sometimes they're there for a period of time, and then they get wiped out.
Okay, does the board have any other questions about the infection report, or the TB report, excuse me?
I mean, is this refugee arrival report accurate? It seems like we have a lot more families than just 3.
Okay, another confusing report.
Sorry.
That was when, so that is a family who is sponsored and comes over. Say I sponsor a family and they come over. What you're referring to are the people at the ICC who are migrants who are coming into the city of Lowell with a different pathway.
So they're not sponsored. So migrants are not sponsored and refugees are sponsored.
Correct. People are coming different pathways.
We don't, yeah, so we don't have a list of the amount of migrant families.
We still have the 361
Okay.
sitting at the ICC. We haven't increased that census.
Okay.
Correct, yeah.
Gotcha.
Just a quick question, and I know I probably should know, but I'm stupid. So viral hemorrhagic fevers.
Yep,
Usually I think about Ebola and crazy things like that.
yep.
So we had 3 contacts with a,
Fever and all that, that's you, right?
3 contacts in this total. No, that was 3 contacts for people who last year traveled
in an area where there was Ebola.
in the area that was Ebola, because we did have to follow some people last year.
Got it.
Yep,
Okay.
yeah, absolutely. You're absolutely correct, Doctor.
Oh, I'm glad I'm not.
You're smarter than you thought you were.
Anything else in the director's report tonight?
No, I don't think so. Staffing's looking better. I think our school nursing is looking better. The city, I don't know if anybody heard, the city gave raises, across the board raises
Paying
to
more than Lowell General does.
most people. So that helped. So we got some school nurses back. So that helped there.
Great.
That's good.
So, yeah.
Is the second syringe collection?
It's posted again. So it's posted again. We've been interviewing, so, yeah.
And, yours is not gonna do that anymore?
No, Andres is doing it, but we're looking for a second syringe coordinator. Yeah, so, yeah. So, but, yeah.
Is there any other business for the board? Anybody have any other issues they'd like to bring up?
This is Public Health Week?
Yes, happy Public Health Week. We
Thank
should
you.
buy you something.
No, that's okay. Thank you.
Next week I'll get it for you.
No, thank you. Nurses Week. We could take care of a lot of people on the board, so thank you.
The next meeting of the Lowell Board of Health will be held on May 1st, 2024 at 6 PM in this room. And if there's nothing else, I'll accept a motion to adjourn.
Motion to adjourn?
Thank you all.
Thank you.
For the record, 6:40.
Great job.